Hi, I'm Dr. Graeme. Now this is a quick introduction to myofascial trigger points, or trigger points for short. Now they're those tender lumps in your muscles that therapists find, and are usually heavily involved in most musculoskeletal pain syndromes such as back, neck and shoulder pain. Now you see diagrams like this to show where the trigger points from each muscle refer pain to, and charts like these in clinics showing the points that refer to each part of your body. Now the important thing to understand is that trigger points start small and gradually grow over time. Now if you've ever been to a massage therapist before, you'll understand that they'll find really tender spots that shoot pain, but you didn't know they were there. Now what's happening is that the muscle starts to feel ropey and lumpy long before you get pain, and that causes the muscle to be tight and not work as well. Now the tightness restriction movements and pulls on where they attach, and because they don't have their normal strength and endurance, you'll fatigue easily and they'll have trouble supporting normal posture and joint movements. Now that's why some people get regular massages and say they feel much better. They feel looser with more energy and feel like they're standing up straighter. Now with that, let's look at trigger point therapies. Now people normally get trigger point therapies when they're in pain, but if you've ever had these before, you'll know that the relief is temporary. The pain comes back again. Now the reason is that whether it's someone pressing on the points or doing courses of laser or needles, all they do is relax the muscle long enough to stop it hurting. Now the lumps might be slightly smaller and the ropiness slightly less, but they're still there. Now they still do the things like restrict your movement and make you tired, and of course eventually start hurting again. Now, the problem is that those lumps and ropiness are changes in your muscles that develop over time. Now courses of therapy relieve the pain, but it takes regular therapies over a long period of time to reverse those changes, and not many people are willing to book in for 100 or more sessions. Now that's why genuine vibration massages like this are the only practical way most people can get rid of their trigger points. Now for a start, the therapeutic vibrations penetrate and do things like relax the muscles and increase the blood flow, which is perfect for treating trigger points. Now there's a caveat with that: you do need a genuine vibration massager. Now massage guns are designed to drive their heads into your muscles like jackhammers, which means they send in far less vibrations than can hurt you, while typical personal use massages like this are not capable of sending in serious amounts of therapeutic vibrations. Now the other reason these are ideal is that they're simple enough to use on yourself, meaning you don't have to make 100 or more appointments. All you need to do is sit the machine on and let the vibrations do the work. There's no pain, no needles, and it's highly effective. Now I'll link above to a video with more details and to our trigger point therapy guide in the description. Thank you very much for watching. It has been most appreciated.